Welcome back to Mid Morning. February is American Heart Month, a time to focus on your heart health.
We're joined by Dr. Shengnan Zheng from St. Joseph Health to discuss heart health, risk factors, and ways to keep your heart strong. Thank you so much for being here with us today.
Thank you for having me.
Tell us the importance of Heart Month.
So Heart Month is a very, very important time of the year. As an interventional cardiologist, I see this as an opportunity to really share and spread awareness of people having all kinds of heart conditions, but then really not taking good care to prevent them and to control their risk factors and to prevent what could have been absolutely preventable complications and comorbidities from this condition.
We talk about risk factors. A lot of these are things that simple steps people can just do at home.
Yes, a lot of those are, but a lot of those, the awareness is key here because a lot of people don't know they have them. I've seen many people come in, they were like, I was healthy, I've never had any issues. And then they come in with a stroke and we realize they've had high blood pressure, high cholesterol, diabetes for at least 10 years because we can see all the sequelae of those conditions. And it's just they never knew because they never felt it. So those are some key things. And in Kentucky, it is especially important because Kentucky is one of the highest nationally ranked state for having high, like age-related heart disease death. We're about 25% higher than other states. In terms of just plain old self-reported having had a heart attack before, Kentucky is around 6.5%. National average is only around 4.2. So it's a significant higher risk for us as Kentuckians to really be aware of our risk factors and prevent what could have been preventable catastrophes.
What are some of those simple steps that we can take to try to prevent heart disease in the long run?
So in the long run, number one is know your numbers. Know your risk factors. If you haven't already, really get in touch with a primary care physician. They will help you screen all your numbers and tell you about the conditions that you have that you don't realize you have. Additionally, stopping smoking is really, really important. And being healthy, exercising, eating regularly, eating a relatively low cholesterol, heart healthy diet, they're all keys in preventing long-term heart disease.
How often do you see people who haven't been to the doctor in years? Maybe they feel good, so they feel like they maybe don't need the regular checkups, and it's things that would have been caught if they were going.
Oh my gosh, I've seen them way more than I should be seeing, which is the key in spreading awareness, because in today's world, people should at least be going to their primary care once every couple of years. Come on. Especially the older people get, the more they're supposed to be more keen on following up. But I've seen so many people that the first time they show up to a doctor's office is when they already have a stroke, when they already have a heart attack, when they have a huge blood clot, when they have risk factors that could have been underlying for years and could have absolutely been prevented.
All more reason to get in touch with you all at St. Joseph Health there. All right, thank you so much for coming in and talking to us.
Thank you.
Thank you.